was at that time interested in medical school, and was actually thinking about getting married, and that was my goal. Those were my goals, was to go to medical school and then have a career in medicine and get married. I lived at the Franciscan Friary on Washington Boulevard, which is now part of St. Louis University, and did that for 2 summers as a college student, not any kind of connection as a Franciscan. And that's when I met more and more of the Franciscan, and it was nothing that I had imagined. I imagined people that walked around and chanted and prayed all the time and were very quiet, and it was a very stoic and boring life. That's what I imagined. And then living there over those 2 summers, they were an interesting group of people. You know, one of them smoked. They all had really good suppers together, in the sense that they ate and laughed and talked. It was a very lively group. And then even in chapel, they had a morning prayer and evening prayer and Mass, and I would join them sometimes for Mass or for evening prayer. And they all sang. The ones that were priests preached very well. And it was, again, all very down to earth. And a couple times they had asked me, "Are you interested in joining to be a Franciscan?" And I was flattered but uninterested. So I graduated. I didn't get into medical school. I came back to Louisville, Kentucky, and did an additional year at University of Louisville, post-baccalaureate, to bring my grades up so I could get into medical school. And began discerning. At that time, I met Father David Lenz, who was the Vocation director. And Vocation directors help people in their discernment process determine, are you or are you not interested in the religious life. And after a couple months, Father David made me an offer I couldn't refuse. He said, "You know, you could be a doctor and be a Franciscan." And I thought, well, then anything's possible. And so at the end of that year, it was going to be at least another year before I could reapply for med school. So I thought, well, I'll try this for a year. And after the end of that first year, I decided I'll try it for another year. And at the end of the second year, I went to novitiate, became a novice. So I wore the habit but had not taken vows. At the end of novitiate, it continued to fit. You know, it continued to feel normal, even though it seemed very abnormal to me. You know, I had aspirations to have a nice house and a nice car and a wife and kids, and none of this fit that, but it still felt right. So I continued to follow it and studied theology for a number of years, and during that time discerned that I was not called to the priesthood. And that was at the end of my 3rd year of theology, and decided that I was called to be a brother, and I knew that I wanted to work in healthcare still. That dream hadn't died. Made solemn profession of vows, which was lifelong commitment to the Franciscans, and then began figuring out what areas of medicine I want to go into, or healthcare, and worked in a clinic in downtown Washington, D.C. for the homeless, and worked with a nurse practitioner and with a physician assistant and the staff there, and felt very interested, very called to be a nurse practitioner, to go into nursing. I liked that model of healthcare. I liked the level of involvement with the patient, and I began to understand the academic rigors of nursing, and I was very interested in not just training to be a technician, but to think in a job that I would have and to be a professional, and to be able to learn how to think critically, not just think about the current task, but everything involved in that task, so I could think outside the box. And that's what I was interested in, and that's what the nurse practitioner did, and that's what the physician assistant did as well, but I just felt that nursing model fit me better. I had a master's degree. I have a master's degree in nursing in it's community health and management, and then completed the doctoral degree last year in nursing, PhD nursing, and with a specialty in patient safety. I interviewed emergency department patients and asked them what they felt was safe and unsafe about their stay, and then wrote the dissertation based on that information from that study. So I finished up that degree and graduated, and